Breast cancer is one of the most common cancers in the United States. It's the most common cancer in females.
Some women can actually feel a lump in their breast that is unusual if they're performing self-breast exams, and they may present to their doctor with an abnormal lump. Most of the time, cancers, however, are picked up on routine screening mammograms, and that's why it's so important to undergo mammographic screening, especially after the age of 40.
When patients first arrive for their consultation, a lot of work has gone into the effort to care for them prior to their first visit. Many times the patient has already had her biopsy. So whether it's breast cancer or any other cancer, the patient has already found the disease and then presents to us for a plan of care.
Patients typically referred to me by a surgeon or the medical oncologist once they've been diagnosed with breast cancer. Sometimes they come in just for consultation prior to making a decision regarding surgery, or sometimes it's after they've had their surgery and they've been completely staged. So during an initial consultation, we sit down, review the patient's entire medical history, their medications, review their pathology and their x-rays, discuss treatment recommendations, answering all the questions that they may have.
It's very important for us to focus on what the patient wants to be done. So we coordinate the care so that if the patient wishes to have breast conservation, if the patient has a significant family history of breast cancer, all of these are taken into consideration when we develop a plan of care.
Once we've made the decision that the patient is going to require radiation therapy, they will come in for an initial simulation, and that's really how we draw up the blueprints of the treatment. It's a mapping session, a CAT scan is performed with the patient, and all those images are loaded onto my computer, and we basically make a 3D model of that patient so that we can come up with a custom treatment plan for that patient.
There's a few different treatment options. We have tomotherapy, and we have rapid arc, and we have, image guidance. And these are all things that are the most sophisticated technologies that are out there now to really minimize side effects from the treatments and to maximize what we want, which is the therapeutic effect of the radiation.
Standard breast radiation therapy, generally we treat the whole breast. It's about a 6 to 6.5 week course of treatment. Treatments are daily, Monday through Friday, 5 days a week. The treatments are carried out on a linear accelerator using either 3D conformal or IMRT technique.
External beam radiation is delivered through a linear accelerator. They're usually on the machine for a few minutes. The radiation is delivered, and then they can get up and leave.
There are some other techniques that we occasionally use in highly selected patients. Breast brachytherapy is sometimes offered for patients that have early stage disease. In this situation, generally a balloon catheter is placed at the time of lumpectomy or shortly thereafter. We can feed a radioactive source through and administer the treatment basically from the inside out. The treatments are given twice a day with 6 hours in between treatments for 5 days.
When patients come to see us, they often have concerns about the radiation.
There are some side effects of radiation, including some skin redness, much like a sunburn. I get an opportunity to take a look at the effect of radiation, see how their skin's doing, and also prescribe lotions and creams that they may need during the course of treatment.
From the beginning of the process in treatment planning, all the way through the delivery of care, there are many, many quality assurance steps that are met. The physician starting the planning for the treatment and deciding which tissues we need to avoid, the dosimetry, allowing us to apply the beams through the technology, and then the physicist, who plays a very key role in performing the quality assurance testing required.
Our organization is very in tune to the overall patient care, from the reception area all the way back to the therapist. Everybody is involved. They're genuinely caring people.
I do worry about my patients a lot. And I spend a lot of time thinking about their cases, discussing them.
Patients who are treated with radiation recognize the technology, but they don't come for the technology. They come for the care. They have to have assurance that you are treating them, maybe as you would your own family member, certainly as you would want to be treated yourself.